So tubal ligation reversal is a very successful treatment. In most cases, for our patients who are under the age of 40, we see a 70 to 75% chance for pregnancy after tubal ligation reversal when we use the microsurgical technique that we do. And generally, our patients who are coming to us, they know that their options are either, well, of course, outside of adoption potentially, but their options are basically IVF or tubal reversal. Well, here's another dichotomy where IVF is a 15 to 20 or $30,000 process with maybe a 30 to 50% chance for pregnancy, or tubal ligation reversal is under $10,000 with not just a 70 to 75% chance of that first pregnancy, but they can go on to have 2, 3, or 4 pregnancies even after a single tubal ligation reversal. So we do tubal reversals, probably several tubal reversals every single month. We love to offer these patients this very life-affirming treatment. Obviously, we're giving them their fertility back by this procedure. So it's an outstanding procedure that we get to offer our patients. And yes, it's surgery. It's slightly invasive in the sense that we're having to make incisions, but we are restoring their normal anatomy, which is so much of what we love to do with restorative reproductive surgery, is that we just want to fix the underlying issue. We want to fix the problem. So in the tubal ligation reversal standpoint, it's a relatively straightforward, if you know the tools and you know how to do it, relatively straightforward procedure to allow somebody to regain their fertility for the rest of their gynecologic or reproductive life.